Antimullerian hormone, AMH. What is the antimullerian hormone? Have you done the fertility test and your report has come out and the results are showing your AMH levels being low or being normal, or your antimullerian hormone AMH levels are very high? Fertility testing. In this video today, we are going to learn about a fertility test, also known as an AMH levels, or an antimullerian hormone test. So stay with me. We are talking about the antimullerian hormone in this video. Without further ado, we shall begin straight away and talk about what is an antimullerian hormone. After this short break, we are going to talk about all this. After this short break, don't leave. Thank you, my friend, for staying around. We are talking about the antimullerian hormone, and specifically the antimullerian hormone, or the AMH fertility test, is a test which is very key in determining what could be causing your fertility, your infertility. So, without further ado, we are talking about the antimullerian hormone. The antimullerian hormone is a hormone which is produced by your follicles. Specifically, when we take a look at an ovary specifically is having what we call the follicles. The follicles are those reserves which store your eggs. So, whenever your eggs are growing, whenever they are in the early stages of growth, they are going to release a hormone. This hormone is known as the antimullerian hormone. The antimullerian hormone can be measured using your blood test. When your doctor wants to determine how your ovaries are, how your fertility state is, then your doctor is going to request for a test on your antimullerian hormone levels. The normal antimullerian hormone levels are between 1 up to 4 ng per mil. So if your report comes out and you have an AMH level of at least 1 or 2 or 3, then it means you are having normal AMH levels. But if your report comes out and you have 0.2, then it means your antimullerian hormone levels are very low, and then there are high chances that you could be having also very low ovarian reserves. What do we mean by very low ovarian reserves? Specifically, the ovarian reserves are the ovaries. That's where the eggs are. So if you are trying to get pregnant and you are having issues getting pregnant, then it is high time you do the AMH level test. It's very important that you do an antimullerian hormone levels. It can show how your ovaries are. It can show how your follicles are. If at all the report shows that your levels are very low, then your doctor may induce ovulation, may give you drugs to stimulate ovulation, for example, Clomid or Letrozole. So it is very, very important. If you are a couple and you have tried to get pregnant, you've tried to get pregnant but things are not working out, it is high time you do the AMH test. Thank you, my friend. We are talking about the AMH test, and Gerard Massa, the health educator, is the name of the channel. I welcome you to our channel. If it's your first time on our channel, remember to subscribe so that you do not miss new videos we talk about every day. We talk about fertility, the ovulation calendar, and we do create awareness about fertility and reproductive health. Antimullerian hormone is our topic for today, and in a nutshell, we've said that this is a fertility test which is used to measure your ovarian reserves. In simple terms, it is a test which is used to determine how your ovaries are, how your eggs are. So if at all the results come out and they are very high, then it means if you actually have a report or you have an AMH level of at least maybe 5. We said normal is between 1 up to 4. If the results come out and you have an AMH level of 5 or 6, then it means there are high chances that you could be having what we call polycystic ovarian syndrome or polycystic ovarian disease. How can you confirm that you have polycystic ovarian disease? Your doctor will do a pelvic ultrasound scan, which will specifically look at your ovaries, and whenever you have small fluid-filled swellings known as cysts, and they are at least 9 and above, maybe you have 15 or 20, then you could be having a condition which is called polycystic ovarian disease. So in this video, we've talked about antimullerian hormone, and it is a very important test for all couples trying to get pregnant. It can show whether you have issues like polycystic ovarian disease or you have low ovarian reserves. Remember, we said that low AMH levels directly signify how your ovaries are. When you have normal AMH readings, then it means your fertility is okay. If you have very low AMH levels, then it means you could be having issues with your ovaries. They are very low. You may need stimulation. This can be done by your doctor. This video is for education and information purposes only. Welcome to our channel. See you in my next video. Gerard Massa, the health educator, and have yourself a fantastic and healthy day. Bye-bye. Why are you not seeing your periods after a miscarriage? You have had a miscarriage and you are not seeing your periods. Why are you not able to see your periods after a miscarriage? I welcome you, my friend, for today's lesson. One of our viewers asked a question and she said, why is she not seeing her periods after her miscarriage? It's coming to 2 months. She is not able to see her periods. We are answering this question. Watch up to the end because there are lots of tips for you to answer this question. So without further ado, we shall first of all talk about what a miscarriage is. When we are talking about a miscarriage, specifically, this is a pregnancy loss at least before the pregnancy makes 20 weeks. So if you are pregnant and before the pregnancy goes to 20 weeks, there happens to be a pregnancy loss or you lose the pregnancy, actually we call this a miscarriage. So why are you not seeing your periods even after you've had the miscarriage? Even after losing the pregnancy, why are you not able to see your periods? First of all, I welcome you on our channel. Gerard Massa, the health educator, is the name of the channel. On this channel, we do talk about fertility, we talk about pregnancy tips, we do give you advice on how you can get pregnant faster, on how you can become fertile and get pregnant faster. And then also, we do give all pregnancy tips, anything related to women's health. I welcome you, and if it's your first time on our channel, remember to subscribe so that you do not miss new videos we release every day. So without further ado, I'll first of all talk about a miscarriage. A miscarriage is a serious condition. When it happens, the first thing is the couple needs to go through a process of healing, both emotionally, psychologically, and then also physically. So if a miscarriage has happened, it's always good to realize that there could have been a problem. There could have been a cause of this miscarriage to happen. You do not need to put the guilt on either of the partner. You should not take up the guilt, because when you become guilty and then you begin putting it on yourself, if you did not induce it yourself, then it may actually put you in depression, and it may affect you psychologically, emotionally, and all areas. So allow yourself time to heal, allow yourself to go through all the healing process. Follow the advice of the experts, and remember, you can get pregnant again even if you've had a miscarriage today or you've had a miscarriage at any time. You can still get pregnant. The only thing you need to do is you need to get the advice of the experts and then follow that advice, put in prayers. You can get pregnant faster. You need to put God first. So without further ado, we are going to answer the question that was asked by one of our viewers, and she said she had a miscarriage, but she has waited to see her periods. Her periods are not happening. Her periods are not seen. So we are saying that the first way we are going to answer this question is, first of all, to identify that if at all you've had a miscarriage, let's say you've had a miscarriage today, and then after 1 or 2 months or after 2 to 3 weeks, you are still spotting, you are still bleeding. This could mean that you could be having an issue with what we call RPOC. RPOC simply means you could be having retained products of conception. You could be having an issue with retained products of conception. Retained products of conception, we mean the pregnancy could have come out, but when there's still remaining pregnancy tissue in your womb. How can you tell that you have retained products of conception? Because you might have had a miscarriage 3 weeks back, but you are still bleeding. The only way to identify that you could be having retained products of conception, you are still having the blood coming out. The only way to identify is by doing what we call a pelvic ultrasound scan. A pelvic ultrasound scan, we've talked about it before. It is a test whereby images will be taken of your reproductive system. These are the ovaries, fallopian tubes, and then your womb. The pelvic ultrasound scan will show how your womb is. If there are retained products of conception, your inside, the endometrial stripe, will not actually be visible. Your doctor will not be able to see this inner lining known as the endometrial stripe. What will be seen on a pelvic ultrasound scan to confirm that you are having retained products of conception will be lots of contents. We call them echogenic contents. You'll see that on your report. If you do your ultrasound scan and the report comes out and it shows that you have lots of contents inside with a volume of maybe 10 mils, 50 mils, or 100 mils. I've worked on clients who have volumes of 200 mils, lots of echogenic contents. They think that probably the pregnancy actually came out fully, but when they are still having lots of contents, lots of pregnancy tissue and mixed with blood. So when you have had a miscarriage today and then after 2 to 3 weeks or after 1 month you've had a miscarriage and you are still bleeding, please urgently go and do a pelvic ultrasound scan. Do it from a reputable place whereby you'll get real results. And once these contents have been identified that you are having these, then your doctor will suggest possible alternative, or your doctor will suggest possible medical treatments for you. Your doctor may decide to give you drugs to help expel these contents if at all the volume is low. Or your doctor could actually opt for your doctor will actually advise for removal through a special procedure known as a D&C. D&C simply means dilatation and curettage. It's a procedure which is done in theater whereby these contents will be removed manually, and normally it's a painful procedure, but you need to prepare yourself psychologically for this. And yes, your doctor will take you through all the counseling pre-operatively, that is before you go to theater. Your doctors and the nurses, the attending nurses, they will help educate you on what will be done in the theater, and then of course you are supposed to sign the consent form allowing that this procedure gets done. And after this procedure has been done by your doctors, remember this is a procedure which is advisable. You should not refuse to do the procedure, because what happens is that if you are having these contents in your womb and then they are not removed, you are most likely going to go into what we call sepsis. Sepsis is when these contents, remember they are mixed with blood, they may actually begin rotting. And then when they do rot, what the end results are going to be, this infection is going to filter into your bloodstream because your uterus is supplied with blood vessels. So these rotting substances or these clots can easily go into your bloodstream, and then they may actually travel to your heart, and what may result may not be good. You may go into actually shock. You may go into what we call septic shock, whereby the results will not be good. So remember to have these contents removed either through tablets if at all the volume is very low. There are drugs which can be given. This video is for education purposes only. We shall not mention all those different types of drugs. But there are special drugs which can be given. They can force your womb to expel these contents manually. Normally, you will experience pain. Remember, the pain is as a result of the contractions happening, and specifically, it may actually be similar to the contractions you get when you are giving birth. But remember to be strong, have this removed, and then give yourself a waiting time of at least 3 months. After these 3 months, you can still get pregnant again. But I always advise my clients to use these 3 months as a time of healing, as a time of identifying what was the cause of the miscarriage in the first place. So we've talked about the miscarriage, we've talked about what could be the causes of bleeding after the miscarriage. We are going to answer the question that was asked by one of our viewers, and she said that she has not been able to see her periods after 2 months of having the miscarriage. She had the miscarriage and then 2 months passed, but she is not able to see her periods again. So we are answering this question. Remember, you are on Gerard Massa, the healtheducator.com, the best fertility pregnancy channel. So ask me all your questions in the comments. I really love to answer all your questions. Ask me anything about pregnancy, about fertility, about how you can get pregnant faster, and I will answer. I will give you my best advice on how you can get pregnant faster. So we are saying that when you are not able to see your periods after 2 months of having had a miscarriage, then the cause could be that there's an imbalance in your hormones. But before we answer this question, we need to identify, or we need to understand that normally when a miscarriage has happened, there's always a cause. When a miscarriage happens, there's always a cause. To see your periods, to get pregnant again after having a miscarriage today, the most important thing is identify the cause. So to wrap up the whole thing, to answer this question that was asked by our subscribers, she's not able to see her periods. The answer is identify the cause of the miscarriage in the first place. We say that miscarriages have causes. If the cause of the miscarriage was stress, remember when a woman is pregnant and she's undergoing excessive stress, she's experiencing excessive stress, there are high chances that there's going to be a hormone. It is called cortisol. It is a stress hormone. So when cortisol has been released, there are high chances that it's going to bring about a miscarriage. So if the cause of the miscarriage was stress, address the stress, manage the stress, and then your periods will simply come back, because when you are out of stress, there are high chances that your hormones are going to go back to normal, they are going to balance. If the cause of the miscarriage was infections, probably maybe you had a PID, also known as a pelvic inflammatory disease. If you had a PID, which is actually confirmed, which is confirmed by doing a pelvic ultrasound scan, free fluid will be seen in a part which is known as the pouch of Douglas. Remember, we've said that the pouch of Douglas is the part between your rectum and your uterus. So if there's free fluid collecting in that part, and you were pregnant and you had the PID, then it's very simple. Treat the PID and then your periods will come back to normal, because PID brings about an imbalance in your hormones. And remember, to see your periods normally, your periods have to be normal. I mean, your hormones have to be normal. You have to be going through the 3 phases. That is the follicular phase, when the eggs are growing, the ovulatory phase, when you are ovulating, and then also the luteal phase, when you have just finished ovulation and probably you've got pregnant. Then the periods do not happen. They will not appear. If at all you do not get pregnant, then these hormones are going to drop and then you'll see your periods. Ask me all your questions and I will answer them. So to answer the question asked by our subscriber, she has not been able to see her periods. The answer is find out the cause of the miscarriage. Go to hospital, let your doctor do all the routine tests. Let a pelvic your doctor will do the pelvic ultrasound scan. Your doctor will do a urine analysis test. Your doctor will do a high vaginal swab test. Your doctor will do actually also some other tests like a urine culture and sensitivity, whereby part of your urine will be taken to the lab and then culture and sensitivity will be done and then the cause will be identified. Remember, you can get pregnant. Ask me all your questions and I will answer them. We have lots of work we are doing in the community with our community-based organization, where we are looking at where we are reaching pregnant mothers in hard-to-reach areas. They are pregnant, but they cannot access ultrasound scan services. So we are using our expertise. We are looking at reaching most of the pregnant mothers in our country, Uganda, in our community. The causes of irregular periods. How to get pregnant with irregular periods. In this video today, we are going to talk about the causes of irregular periods and how you can get pregnant even if you have irregular periods. Are you a woman? Are you a couple and you have tried to get pregnant but you have irregular periods? Then in this video, we are going to discuss the causes of irregular periods and everything you need to know about the causes of irregular periods. Gerard Massa, the health educator, is the name of the channel. After this short break, we are coming back and we are talking about the causes of irregular periods. After this short break. Hello my friend, welcome for today's lesson. This is Gerard Massa, the health educator. I welcome you to our channel. If it's your first time here, remember to subscribe so that you do not miss new videos we release every day. On this channel, Gerard Massa, the health educator, we talk about the ovulation calendar, we talk about the ovulation calculator, and we do also give pregnancy advice. Remember to subscribe so that you do not miss any videos we release. I welcome you, my friend, and watch up to the end because there's lots of information, lots of good tips for you today. Have yourself a good time watching this video. I welcome you, my friend. Thank you. Thank you, my friend. We are talking about the causes of irregular periods, and without further ado, we are going to go to the first cause of irregular periods, and this is known as anovulation. Anovulation simply means failure to ovulate. If a woman does not release a mature egg on the 14th day, we call this anovulation. So if you are not able to ovulate, then it means you will not be able to get pregnant, because during ovulation, the mature egg, also known as the Graafian follicle, is released, and this mature egg goes on and it gets fertilized to become a fertilized egg or to become a fertilized embryo. So anovulation is among the leading causes of irregular periods. The main reason is that for ovulation to take place, the two hormones, the follicle stimulating hormone and the luteinizing hormone, should be within the normal ranges. If these two hormones are not balancing, then there are high chances that fertilization or ovulation will not be able to proceed. So the first cause of anovulation, the first cause of irregular periods is anovulation, and we have said that anovulation simply means failure to ovulate. So if you are a woman and you are asking yourself, why are you not getting pregnant? Why do you keep having irregular periods? This month you see your periods, next month you do not see your periods, then anovulation could be among the things which could be happening to you. Remember, the only way to confirm that you could be having an ovulation is having tests done on you. Specifically, your blood should be checked for, you should have a test done which is known as the Fertility Hormonal Screen Test. And we are proceeding with our lesson for today, the causes of irregular periods, and the next cause is known as polycystic ovarian syndrome. Polycystic ovarian syndrome, abbreviated as PCOS or polycystic ovarian disease, PCOD, is very, very common nowadays. It's becoming very common. This is when your ovaries specifically grow some small swellings. These are known as cysts, and because they are many, they are called polycystic ovarian syndrome. So if you are a woman and you are having irregular periods, then you could be having polycystic ovarian syndrome. If you have not heard about this condition, it is among the leading causes of irregular periods, and the only way to confirm that you could be having polycystic ovarian syndrome is that you should check with your doctor, who will request for some tests to be performed on you. Your doctor will do what we call a pelvic ultrasound scan, and by doing the pelvic ultrasound scan, images of your ovaries, images of your reproductive organs will be taken. More precisely, your ovarian reserves or your ovarian follicular activity, or the follicles are specifically those round-like structures where an egg grows until the 14th day. That is the day of ovulation, when that round structure bursts or ruptures, and then an egg is released to go on and get fertilized. So in polycystic ovarian syndrome, when you do an ultrasound scan, the report will show that your ovary is lined with many small fluid-filled growths or fluid-filled masses. These are what we call the polycystic ovarian syndrome, or these are basically what we call the polycysts. So remember, even if you have been told that you have polycystic ovarian syndrome, you should not lose heart. You should not despair. One thing that is true is that even if you have polycystic ovarian syndrome, you can get pregnant. You can easily get pregnant. The key is that you should have yourself get checked. Your doctors will do a pelvic ultrasound scan on you, and then also your doctors will also request for a laboratory test to be done on you, where a profile of your hormones will be analyzed. A profile of your hormones will be analyzed, whereby the levels of the key hormones, including the follicle stimulating hormone, also known as FSH, and then LOH, and then also estrogen plus testosterone levels will be analyzed. In some countries, the doctors also may request for a test known as the AMH, or the Antimullerian Hormone levels, and then all your Antimullerian reserves. Then you'll be able to be given the report, and then if conclusion or if a diagnosis of polycystic ovarian syndrome is reached, then your doctors will advise on which treatment you can get. Remember, you can get pregnant even if you have polycystic ovarian syndrome, but pregnancy begins with investigations being done, and then after polycystic ovarian syndrome has been discovered, then treatment can be given, and thereby treatments include drugs which may stimulate ovulation to happen naturally, because in polycystic ovarian syndrome, normally there's a low level of estrogen, and then also there's an imbalance in the key hormones which are responsible for the menstrual cycle to happen. So if you have polycystic ovarian syndrome, the key begins, or the solution begins, with doing the tests. After doing the tests, then treatment can be given. We are talking about the causes of irregular periods and how you can get pregnant even if you have irregular periods. Gerard Masa. The Health Educator is the name of the channel, and I welcome you, my friend. If it's your first time on this channel, remember to subscribe so that you do not miss any new videos we release every day. Next cause of irregular periods is thyroid imbalance. When we talk about the thyroid, we are talking about that part, that small part around the front of your neck. It's a small organ which is responsible for key processes in the body, and specifically it releases hormones like the thyroid stimulating hormone. These hormones are responsible in playing major functions in your body, including the regulation systems or key functions like your menstrual cycle. So an overactive thyroid gland or an underactive thyroid gland, we are talking about an overactive thyroid gland. We mean a thyroid gland which is functioning very, very high, and its function is really very high, more than what it's supposed to be doing. It's releasing the hormones at a very high level. And then an underactive thyroid gland is a thyroid gland which is actually working, but it is really sluggishly. It is working but at low levels, at its minimum. So when we talk about thyroid imbalance, we are looking at specifically an overactive thyroid gland and then an underactive thyroid gland. And how can you tell that you could be having issues with your thyroid gland? There will be signs and symptoms, and the first sign is that you will be having irregular periods, because actually it's among the causes of irregular periods. Like, that's why we've put it in this lesson today. Then you will also experience painful sex coming as a result of vaginal dryness, and still this goes back to the hormones being irregular or the hormones being imbalanced. So if you have irregular periods, it is high time you consult your doctor to do some tests, because much as we may be thinking of the ovaries and the other systems responsible for pregnancy, but you could be having issues with your thyroid gland. You may be having issues with your thyroid gland. Thanks a lot, my friend. We are proceeding with our lesson, but before we proceed much further, you actually book an appointment with me. You can book an appointment with me. The link is in the description below this video. You may want to have a one-on-one consultation with me. You have that burning question you've always wanted to get answers to. I'm available. All you need to do is you go to the first link in the description below this video, and then click on that link. You'll be directed to a page whereby you'll do your booking, and the booking is very, very affordable compared to the knowledge, compared to the value you are going to get. So it's really very, very important. If you would like to have a one-on-one appointment with me, you can go to the description and then you book. We are proceeding with our lesson for today, and we are talking about the causes of irregular periods and how you can get pregnant even if you have irregular periods. The next cause is what we call hyperprolactinemia. Hyperprolactinemia is a big word, but we shall break it into small parts which are really understandable. We shall begin with the word hyper. Hyper means something that is high. Prolactinemia comes from prolactin. Prolactin is a hormone which is responsible for making your breasts to grow normally, to produce milk at the right time. That is when you are breastfeeding, and specifically to be of normal average size. The main issue here is if this hormone known as prolactin, if it is overactive, if it is very high in your blood, then we call this hyperprolactinemia. And the signs of hyperprolactinemia, you'll be having difficulties sleeping, you'll be restless. The other thing is that your periods will be irregular. That's why it has qualified to be on the list of causes of irregular periods. Your periods will be irregular. you try to get pregnant, but because the periods are irregular, getting pregnant may be difficult, and still there may be interaction with other hormones in your body bringing about difficulties in getting pregnant. So the only way to confirm that you could be having hyperprolactinemia is by doing a test in the laboratory. Your doctor will request for a test known as a fertility hormonal screen test, specifically looking for prolactin and then other key hormones like FSH and LH. So your doctor may decide to only look for prolactin levels in your blood. So still this, it remains, it is basically the doctor's decision, your doctor's decision to make, but the test for hyperprolactinemia is a laboratory test for prolactin levels, and according to the laboratory or according to the country you are doing your test, there's going to be reference ranges on the laboratory report whereby they will tell you that the normal is supposed to be from this up to this. So if your results come out and your levels, let's take an example, if your levels are supposed to be 2 up to 4, and then you report your results from the laboratory come out and you are having maybe 30, then instead of 2 up to 4 and you're in 30, it means 30 is high, and that's why we call it hyperprolactinemia. There's lots of treatments available for you. All you need to do is you need to seek medical advice. In case you'd like to have a one-on-one consultation with me, you can click the link in the description, the first link, or the first link in the pinned comment section where the comments are, but the first link, you can still click on it and then I'll be waiting for you. I'm really ready to talk to you and solve all your questions in regards to how you can get pregnant faster naturally, because I've been doing this for over 10 years and I believe we can work together. Putting God first, things can work out. We are proceeding with hyperprolactinemia. We've talked about the tests. We've said you can do a laboratory test for prolactin levels, but without forgetting, it's also very important to note that you actually should do you should also actually do a breast ultrasound scan. When you have been told that you have issues with your prolactin levels in the blood, then it is very important that you should also do a breast ultrasound scan, because much as we may be thinking of hyperprolactinemia, but there could be changes happening in your breast. So it's always advisable, because if you do an ultrasound scan and the ultrasound scan shows that your breast is still undergoing some changes, like maybe you have adenomas growing or fibroadenomas, these are growths, or these are actually growths in your breast, then compared with the laboratory results showing that you have hyperprolactinemia, treatment can be given, and remember, you can get pregnant. Next cause of irregular periods is primary ovarian failure. Primary ovarian failure, also known as primary ovarian insufficiency in some countries, is among the rarest it's among the rarest conditions, or it's among the rarest causes of irregular periods. In primary ovarian failure, your estrogen levels, your follicle stimulating hormone tends to be abnormally low, and it's actually as a result of hormonal imbalances. Primary ovarian failure means that your ovaries have failed. Your ovaries are not releasing the egg. You are not ovulating. You are not able to ovulate. And still it goes down to what could be bringing about this. You need to talk to your doctor, who will advise you on how to manage primary ovarian failure, but it's among the rarest conditions, and normally this is a condition which needs even family support, because in some cases actually treatment may not be available. So the only way to confirm that you could be having primary ovarian failure, you will begin seeing some changes happening. The first change is that you will experience irregular periods. So we are not saying that all women who are having irregular periods have primary ovarian failure. As you've seen, there are lots of causes, there are lots of connections to irregular periods. But if at all you are suspecting something not right, it's always good to go ahead and face your fears, do the tests, talk to your gynecologists, talk to your doctors. They will identify the cause and there's always going to be a solution. The most important thing I always tell my clients is that it's always very important to identify the cause. If at all you are looking at, let's say I'm in Uganda and we are getting clients with signs of malaria, signs of typhoid. These are tropical diseases. You may be watching this video and you don't know anything about malaria, but these are tropical diseases, and also they may also be in other countries, but they are so rampant in Africa. So the only way to go ahead and confirm that this patient could be having malaria or could be having typhoid or this patient could be having any other conditions, the only way to confirm is by doing laboratory tests, is by doing investigations. I get lots of my clients asking me on WhatsApp, and they are like, get me the treatment, let me have the treatment for this, let me have the treatment for maybe this condition. And the key is, begin with the investigations. Send me the reports of your tests. Send me the report of your ultrasound scan. I will look at the ultrasound scan. Maybe the ultrasound scan is showing that you have a fibroid. I will advise you on how to manage the fibroid. If the ultrasound scan is showing that you could be having endometritis, I will advise you on how to manage the endometritis. If your ultrasound scan is showing that you have a cyst or a tubal ovarian mass, probably maybe a cystic mass or a dermoid cyst or anything, the key here is that always do tests. There are lots of clients there are lots of clients I've worked on for over the 10 years I've been practicing in the field. I've identified that the clients who undergo investigations, the clients who do tests, normally tend to have a good prognosis or a good recovery. So we are talking about the causes of irregular periods. Gerard Massa, the health educator, is the name of the channel. I'm really so happy, my friend, that you are still with me. You are still attending the lesson. I hope you have your pen and paper, a writing pad, and I hope you're taking note of all this because it is key. It is important. So the next cause of irregular periods is obesity. A study was done and it was discovered that women who are obese tend to release lots of estrogen, and when there's overproduction of estrogen in the body, there's going to be a condition known as endometrial hyperplasia. Endometrial hyperplasia, in simple words, means the lining that inside wall of your womb becomes thickened. It becomes very hard in such a way that implantation may be difficult. In other words, getting pregnant becomes very difficult. And then remember, during your periods or during your menses, your endometrial wall is going to shed. So if you are having obesity, if you are obese and you're releasing lots of estrogen, there are hormonal imbalances happening, then you may actually have difficulties getting pregnant. I'm not saying that all obese women cannot get pregnant. They can get pregnant, but the biggest percentage tend to have issues with getting pregnant. And the issue here, or the key, is that you should have yourself get checked. You can actually, your doctor will talk about, your doctor might advise you to lose some weight, but it's very important for your doctor to also pay close attention at the hormones, because the obesity, if you have tried to lose weight, you exercise, you do the workouts, you are actually watching your diet, and the weight is not going, the weight could be connected to your hormones. So you may actually have to look at your hormones. Your doctor may have to take a closer look at your hormones, and once a discovery is made that you are having hormonal issues, then the hormones or the key hormones which are causing the obesity will be managed. Next cause of irregular periods is if you are underweight. Remember, we talked about obesity and we said that it is connected to hormones and it is among the leading causes of irregular periods. Still, if you are underweight, you can actually have issues with irregular periods, although this does not apply to all
women who are underweight, but the biggest percentage tend to have issues with their periods, because I work on clients every day. I see them. Normally, clients who are underweight, when you ask them about their history in regards to periods, in regards to menstruation, they will tell you they are having issues. Although there are some who are normal, but the biggest percentage tend to have issues, and still your doctor will advise you on what needs to be done to actually stabilize your hormones so that you can add on some little average weight. Remember, the normal body mass index is supposed to be 18.5 up to 24.5. So if you are not within the normal body mass index, you could actually consider seeing your doctor, and then your doctor will advise you on what needs to be done. You can still book an appointment to have a one-on-one consultation with me. I'm Gerard Massa, the health educator. I'm a fertility expert. I will advise you. I'll be your fertility coach, and I will be with you, work with you on this journey of getting pregnant, and I will advise you where necessary. Just click the link in the description below this video. You could also connect with me on WhatsApp. The numbers are in the corner. They are in yellow and black. But still, when you go to my WhatsApp, you'll be redirected to a page where you make your booking, and then we shall have a lengthy conversation and also advise you on how you can get pregnant faster naturally, on how you can manage your irregular periods. I welcome you, my friend, on this channel, and please have yourself a fantastic and healthy day. Share and recommend our channel to many of our friends so that they can also benefit from these lessons. Thank you, my friend, and have yourself a fantastic and healthy day. May God bless us all. Bye-bye.
Thank you for attending today's lesson. Remember to subscribe for new videos we release every day, and we release new videos every day at exactly 17 hours. Thank you for attending today's lesson. I hope you've learned something from today's lesson. Let me answer all your questions down below in the comments. Have yourself a fantastic and healthy day. God Master, the health educator, wishes you a very fantastic day. Bye-bye. How many days after your period can you get pregnant? I welcome you to our channel. Today we are going to discuss a very important topic that has been asked many times. How many days after your periods can you get pregnant? Gerard Massa, the health educator, is the name of the channel, and I'm really so happy that you have joined me on this lesson today. So, how many days after your periods can you get pregnant? To answer this question, the most important thing we need to take from this question is that when we are looking at how many days after your periods can you get pregnant, we are looking at pregnancy, and then we are looking at your periods. If you see your periods today, how many days are you going to take to get pregnant? It's a commonly asked question. So before we answer this question, we shall understand that for you to get pregnant, you are supposed to be ovulating very well, and then your fallopian tubes should be viable, or your fallopian tubes should be open. Next thing is that your womb, your uterine womb, should be free from disease. It should be free from issues like fibroids or even cysts. So if you see your period today, assuming today is the first day you've seen your periods, and then the next day you're going to see your periods is maybe after 32 days or 34 days or 35 days, then we call that length from the first day of seeing your periods to the first day of your next period. We call that your menstrual cycle. So we first of all have to understand how long your menstrual cycle is. How long does it take you to see your periods? Having understood how long your menstrual cycle is, assuming your menstrual cycle goes for 35 days, then we are supposed to first of all assess and get your ovulation day. The ovulation day is the day the egg is released, and it is the 14th day from the first day you see your periods. If you see your periods today, and then you are looking at calculating your ovulation day, then simply just count 14 days. And then on the 14th day, we've said that is when your egg will be released. So what we shall have to do is we shall take the 3 days leading to the 14th day. The 14th day is maybe tomorrow. You begin counting from yesterday, or you begin counting 3 days leading to ovulation or leading to the 14th day, and then also you add on 2 days in front. But if you are looking at getting pregnant and you have regular periods, then we advise that you begin being with your partner. You begin being with your partner for at least 3 to 4 days before you see before your ovulation day. If you are looking at increasing the chances of you getting pregnant, be with your partner 3 to 4 days before you ovulate. The reason is that when sperm has been released, it stays in a woman's womb for at least 4 to 5 days. Whereas when an egg has been released on the day of ovulation, it only stays, or it only lasts for 12 to 24 hours, meaning roughly it stays for only 1 day. If it is not fertilized, then it disappears or it disintegrates. If the egg has been fertilized, then it goes on and forms a round shape known as a blastocyst, which moves through your fallopian tubes, being pushed by a process known as cilia, and then it will be pushed up to your womb, where it will attach or it will implant. How many days after your periods will you be able to get pregnant? We are answering this question, and we are going to proceed and say that if you saw your periods on day 1, you are calculating how many days after your periods will you be able to get pregnant. You saw your periods on day 1, you saw your periods on day 2, and then day 3, assuming your periods go for only 3 days. Then the first day, second day, and third day, those are your safe days. You are not able to get pregnant when you are in your periods, and even 3 to 4 days after your periods. So to answer the question, how many days after your periods can you get pregnant? Normally, it is 5 to 6 days, but this differs from woman to woman because there are women who have regular menstrual cycles. Regular means that if you see your periods today and then the next day you're going to see your periods is going to be on 25th, then it is a consistent schedule whereby there are no changes. Whereas if you are a woman and you have irregular periods, you see your periods today, and then next month you do not see your periods, and then the following month you see your periods, then it kind of becomes tricky. This method may not work for you very well. So it is always good for you to add on some other methods on how you can really monitor your cycle very well. And when we talk about adding on some other methods, you can actually use what we call the OPK kits. OPK means the Ovulation Predictor Kits. If you are a woman and you have irregular periods, you are trying to get pregnant but your periods are irregular, then I advise that you get what we call the Ovulation Predictor Kits. These specifically look for hormones, and they look for hormones in your urine. They look for the hormone known as the luteinizing hormone, and then also there are those which have been made specifically to look for 2 hormones. They look for the hormone LH and then also look for estrogen hormone. So it is very important if you are trying to get pregnant to use the Ovulation Predictor Kits, and then you can also try to do other tests. For example, you need to check the overall level of your womb. You need to do what we call a pelvic ultrasound scan. Gerard Massa, the health educator, is the name of the channel. I welcome you to my channel. If it's your first time, remember to subscribe. And then also remember to click on the join button to support our channel so that we can make more videos. And then also you can schedule a private visit with me on my website, gerardmassa.thehealtheducator.com, and we shall talk privately. If you've been having that question you would like to be answered in private. Have yourself a fantastic